Welcome back to Midday Kentucky, everyone. Today I'm joined by the most famous bariatric surgeon in the state of Kentucky, if not America. Of course, you know him as Dr. Eric Smith from Georgetown Bariatrics and Advanced Surgical Services. How are you, my friend?
I'm doing good.
Okay, we have been discussing these conversations for almost 3 years. Did you know that? You were one of our first guests on our show. I want you to tell us what surgeries you offer over there at the clinic.
So we offer sleeve gastrectomy,
Yes.
we offer room-wide gastric bypass, we offer adjustable gastric banding, we offer the Orbera intragastric balloon, and then I offer a variety of revisionary surgeries if people have had previous weight loss surgeries that we can change over, and those are all done robotic.
Okay, now you're a specialist when it comes to robotic surgery. Why robotic surgery for these procedures, along with your other ones to begin with?
You know, the easiest way I can describe it to people is, you know, if you had to go to work with cast from your wrist all the way up to your shoulder,
Yes.
and work like this all day long, and then the next day I take the cast off and you have your joints to use, which would you prefer? Robotic surgery allows us in a minimally invasive way to have wristed motion through small incisions. My optics are 10 times magnified. I can see in 3D like I can with my own eyes if I was doing open surgery. It's tremorless surgery. There's no slight tremors with the instruments that we use. It's something I already did laparoscopically, and the precision is just improved. So why wouldn't we offer that to patients as long as we master the equipment and the skill?
Where do you see it going after this step? Can we get any more advanced?
Oh gosh.
Apart from robotic surgery, what's the next level?
You know, I don't know. I think robotic surgery is definitely growing
Yeah.
and taking over multiple specialties. So they're going to continue to fine-tune the instruments, make things even better, however that may be. You know, I've seen some stuff in the lab that the company is working on. It's pretty amazing, some of the stuff that they're looking at right now. But, you know, 20 years ago, we thought we were doing a pretty good job, which we were.
Yeah.
So there's just no way to predict that.
You travel the country talking and discussing with other surgeons about the benefits and the necessities of robotic surgery. Why did you choose that part of your career as well? Why did you want to go down that road?
For robotic surgery, you know, I think that I was already an advanced minimally invasive surgeon,
Yeah.
and so I was always looking for what can make me better. I
What's
think you
next?
can't
Yeah.
rest on your laurels and say, well, I'm doing a really good job. That doesn't mean that we can't continue to look at how can we improve upon it. Every year, even our program, we sit down in rooms and say, how can we get better? How can we reach more people? How can we do a better job of trying to help patients? And as a professional, that's my job, I think, to look at how can I improve my surgical skills constantly.
Dr. Eric Smith, tell me a little bit about how many surgeries you've actually performed over there using the robotic service.
I've performed around 2,500 robotic surgeries.
Okay. I want to jump back to another question that I asked you once before. Why did you decide to specialize in weight loss procedures?
You know, I think in my training, I was exposed to bariatric surgery. It was challenging surgery. It's difficult surgery, so I like the challenge of that. But, you know, to make an impact on patients, there's nothing more rewarding than that. You know, I've told people before, it's probably a little selfish why I do it, because I like getting to see the changes that I can make in patients' lives.
All right. Well, everyone sitting at home, I'm sure wants to know what sets your program apart from every other program that they have a choice of.
You know, I think we're by far the most comprehensive program that you'll find, and this is different than any other surgery. It's not you just meet your surgeon, you have a procedure, and you go on about your way. This is a lifestyle change, and we recommend lifelong follow-up. So the combination of all the education that we do, if you meet anybody that comes to our program, the one thing they'll never say is that they're not educated and then some.
Yeah.
The dietary education and support that we have, from the support from my physician's assistant, our bariatric nurses, all the people that help with that. You know, I tell people all the time, I get the credit because I get to be on the show or my name's on the placard, but there's a lot of people involved, and it's a team approach, and that's why we're so successful.
And that's why we love having you on the show as well, sharing your story and also sharing the story of all the patients that come in. We appreciate you. If you want to find out more information about Dr. Eric Smith and Georgetown Bariatrics and Advanced Surgical Services, all the information is up on your screen, everyone. We'll be right back after this short break. You're watching Midday Kentucky.